My name is Rita Omene, Communication 101. Communication 101. I will be I will be educating the public on the concept of healthcare inequality, equity, and reason why it should be observed in ensuring that equal opportunity are given to all when it comes to accessing medical services. Choosing between the two ways of information sharing, I will be providing the definition of the term healthcare equity, as well as discussing the implications of the concept. Therefore, by employing the informative style of writing, I will be able to explain the importance of the issue in details and with clarity. Healthcare equity means that all people should receive adequate and quality healthcare services irrespective of their financial situation, the color of their skin, and geographical location. Solving this problem is important in order to encourage the development of healthcare society and decreasing the avoidant morbidity. I will use the tropical categorical method of organization. This approach enabled me to define healthcare equity, discuss the root cause of disparity, and discuss how the problem can be solved. In this manner, I can arrange my idea and information in a way that will be easy to understood by my audience. I would like to address anyone interested in public health, community activity, and policymaker. This cover the students and worker of professional who student and worker of professionals who want to combat this healthcare inequality. Consider a woman carrying a sick child to the emergency room and being turned away because she has no insurance. This is not an imaginary story. Such things occur every day in every day. Healthcare inequality is a phenomenon in which affects millions of people and also cause unnecessary pain and even death. As a nurse, these inequalities are evidence in our everyday practice. In this post, I will explain the I will explain what healthcare equity is, why equity persists, and how change can be implemented to improve the lives of millions of people. Let us discuss why healthcare equity is not a matter of policy, but a matter of conscience. Healthcare equity means that every person should be able to get the healthcare they deserve, they require, irrespective of their level of their income level or the race or geographical location. Who define equity as avoidance of unnecessary and unfair inequalities in a health of difference of population groups. It is and in this access to healthcare service, the concept is based on the fact that healthcare is a fundamental human right. However, this is not the case of a systemic injustice. It's not the case as the systemic injustice make it difficult for the vulnerable groups. Knowing the meaning of healthcare equity now allow for the discussion of how this idea is hampered by social injustice. Factors that hinder the achievement of healthcare injustice include high costs, lack of insurance, and variation is and variation in accessing the facility. For example, the urban hospitals are always congested, while the rural region has severe shortage of healthcare facilities and personnel. Also, the minorities experience systemic prejudice in the healthcare system, which results in an adverse outcome. A cross-sectional study conducted in 2023 revealed that people in low-income households are 2 to 3 times more likely to suffer from unattended chronic diseases due to poverty and structural factors and other structural factors. Although this barrier may at times appear very difficult to overcome, this paper has explored some creative and collaborative way of managing them. Healthcare equity cannot be attained without a combination of policy change, community health intervention, and education. Country with universal health system like Canada and UK can also can be used as a model for tackling unequal access. Investment in underdeserved area can also help fill the gap in the healthcare system. For instance, the Affordable Care Act in United States has increased coverage to millions of people, but also it's still a lot to do. Last but not the least, community health intervention and awareness enhance a capacity of individual to demand for their right and freely access services. By identifying system barrier and offering specific measures for this elimination, it will be possible to design a healthcare system that functions equally well for all citizens. Healthcare, healthcare equity is not just a gender for a provision of healthcare services. It is a question of justice and human right. Why the definitions of healthcare equity in mind, knowing the barrier that exists as well as the possible measures that can be taken to eliminate them. It is possible to work towards a future in which no one is excluded from receiving the necessary medical care. So, as you walk away from this moment, I encourage you to ask yourself how can you support this important mission? Together, we can work towards making a healthcare a right for everyone in this world and not just a privilege. Thank you. In order to assist my speech, I will incorporate a PowerPoint presentation. Some of these items that I will use in this slide as statistics, graphs, or healthcare inequity, an image that creates a sense of compassion. This will help in making the audience more engaged and ensure that they are well informed on certain issue. For assistance, I will provide a graph showing the results of healthcare inequity and equitable system. This aid will help to make an intended message clear and also to easily to remember. Thank you.